welcome back to Prevention Works. I'm your co-host, Emily Hatchwell, and we have Michelle Simons with me. And today we will be interviewing Ariele Goldman, who is a person in recovery. So she currently is a student at North Shore Community College in the Substance and Addiction program, which I think I just got wrong, but Michelle will talk more about that program in a second. And she currently works in the substance abuse field, and she plans on being a counselor in the future. So I'm going to have Michelle talk a little bit more about the program that they have at North Shore, and then I'm going to go on and give a few little quick facts before we talk to Ariele, just so you know what she's talking about when she mentions a few things.
Yeah, sure. So the program at North Shore Community College is, and Ariele, please correct me if I mess this up too.
Sure.
But it's the Drug and Alcohol Rehabilitation Program.
Got it.
It's a 2-year associate's degree for somebody that's working their way towards being a drug and alcohol or addictions counselor, and working towards what's called a LADAC, which is a licensed alcohol and drug counselor under the state of Massachusetts. That's a license I actually acquired a few years ago. There's also a shorter term program. Is it 6 months? Or
It's the first year.
the first year.
Of the 2-year program. Yeah.
So the first year of the 2-year program you can actually do if you don't want to commit to the full 2 years is 1 year, and you earn a certificate in drug and alcohol rehabilitation, correct? Steve Chisholm is the director of the program there, great friend of mine as well as a colleague, and his classes are wonderful. So even just to meet Steve Chisholm and enjoy some of his classes, it's a good time. So little plug for the program there.
So now that we talked a little bit about the program, I'm just going to talk about a few of the substances that Ariele will mention, just so that you know what she's talking about, because there are a few that are familiar, but there are also a few that are unfamiliar. So the first one I'm going to talk about is opiates, and that is one of the main part of our programs. So an opiate is a pain reliever, so it's given to treat pain, but painkillers that are prescribed by your doctor are actually in the same family as heroin and opiates. So they basically have the same effect as heroin and fentanyl. And heroin is just a little stronger than opiates. And people can overdose on opiates. And this overdose can be reversed by Narcan. And when people use opiates, they can suffer withdrawal symptoms that are about the flu times 100, basically. And I know Ariele will talk a little bit further about this. She's also going to talk about Adderall, and that's one that a lot of people have already probably heard about, but we just wanted to make sure we knew some of the basic facts. So Adderall is an amphetamine, so it's a stimulant which increases processes in the body, which means it increases your alertness, your attention, and your energy. But it can also raise blood pressure and your heart rate. So like prescription painkillers, it's relatively safe and effective, but when it's misused, it can cause dependence and addiction. And the last one that I want to talk about is a little more unfamiliar. It's gabapentin. It's one that I'm still learning about and getting the bearings on. So we have gabapentin, and Neurontin is like the generic name. So it's used with other medications to prevent and control seizures and relieve nerve pain in adults. And it has actually been prescribed as a mood stabilizer. And it's one of those ones, it works for a while, but then once it stops, like after a few weeks, it doesn't necessarily have the same effect. But the withdrawal symptoms for this are very severe, and they're very similar to an opioid withdrawal. And I know, again, Ariele is going to talk a little bit about this when we talk to her. So I'm going to turn it over to Michelle, and we're going to start our interview with Ariele. So thank you for being here today. We really appreciate it.
Me.
Thank you, Emily. That's great information, and I think a lot of times people don't know the risks of prescription medications, right? I think we have this sort of misconceived concept that if it's a street drug, it's bad and dangerous, but if it's prescribed by a doctor, it's safe, right? Yeah. It's prescribed. However, I think a lot of addictions starts with a prescription medication. In fact, 80% of people that struggle with heroin addiction started on a prescription painkiller, an opioid. And some examples of that are like a Percocet or OxyContin, codeine, Vicodin, and there's probably a couple of others that are lighter opiates, but those are the main, I think. Did I miss anything?
No, not that I can think of.
Okay. So yeah, I think those are the main prescriptions, and they're prescribed for pain usually.
Yep.
Yeah. So thanks, Emily. That's great information. Yeah. So we're going to have a little conversation with Ariele Goldman. We'll direct our attention here now and try not to put her too much on the spot or scare her. So Ariele Goldman is a colleague of ours. She's been working as an intern with Prevention Werks now since
September.
Last September.
Yeah, sadly, we're going to lose her soon.
No, I'm not going.
She's staying with us.
We're going to lose her as our intern, but we're going to gain her as a volunteer to help us with Prevention Werks.
Yes, exactly.
Absolutely. She's even got like a signature mug now, so she's part of the team. We can put a little shot on that. There you go. So anyway, so Ariele is in this drug and alcohol rehabilitation program, the one we were discussing at North Shore Community College under Steve Chisholm. And that's why she ended up doing this internship with us, because it requires, how long of an internship?
So it's 2 semesters. So you have the first semester, part 1 of the internship, and then second semester is part 2 of the internship.
Okay, great. So that's why we've seen you from September till May.
Yeah, that's why I won't leave.
And what's great is, you know, these internships can lead to a career.
Right.
They can lead to, even if it's just like a fun volunteer position, you know, you just never know. So that's great.
Yeah.
Yeah. So what we're really here for today is to talk about your recovery. You're open about being a person in recovery. And how long now?
So I have been clean since January 24th, 2017. So I think that's 2 years and 4 months, almost. Yep.
Yeah.
Emily will do the math.
Yeah.
No, she's right. Yeah.
Good. So tell me first, what does that mean to you, like person in recovery and being clean? Maybe our audience doesn't know what that means.
So for me, being a person in recovery means that I abstain from all mind-altering substances, but that's just like the surface value of it. What it really means to me is constant work in progress, constantly working at myself, being aware of myself, listening to my mind and body, and just having an overall psychic change from where I was before. Kind of like, you know, when you go the wrong way on the GPS, it like reroutes. So it's kind of like where I've been, like I'm rerouting to a different path. And I have a network of people that I talk to and run things by, and they help me every day to learn to help myself grow and become a better person.
Well, awesome. Nice. That's a great explanation. Thank you. Yeah, because I think we hear that term thrown around a lot, like person in recovery, like what does that mean? And there's lots of different definitions. You know, like SAMHSA, the Substance Abuse for Mental Health Association, has a particular definition talking about somebody progressing towards sort of bettering their life. The, you know, Connecticut Community of Addiction Recovery coaching has their definition, which is you're in recovery when you say you are.
Right.
So that could mean anything, right?
Really, yeah.
So that could mean anything. And then we have 12-step fellowships, and when we say we're in recovery, that means something different to people. And usually, if you're discussing that, you're talking about what you're discussing, which is a program of abstinence. So great, and what we do know also is there are many pathways to recovery. So this is not the only one, but we're going to highlight this today.
Right.
Yeah, great. So, so obviously you weren't born into recovery nor born into addiction.
Right.
So it all starts and begins somewhere. And since you have a couple of years in recovery now, what I do know about you is you have some insight on the disease of addiction with your own experience.
Right.
So first I'm going to ask, can you just tell me a little bit about what growing up was like for you and, you know, how you felt as a kid?
So growing up for me was, you know, I had everything pretty much handed to me. I had a really good childhood. The cards were dealt for me to succeed. You know, everything looked really good on the surface. I went to private school. And from the way it looked, like I should have had a very happy childhood, and there were happy moments. There definitely were, but there was always something wrong internally for me. I just was a very angry, miserable little kid, and there were no outside reasons as to why I should feel like that. And from a young age, I was manipulating and lying, and there's like a couple funny stories, but one that I'll throw out there is like we had a school fundraiser where we were selling chocolate bars, and I would wake up in the middle of the night and eat all the chocolate bars, and I won all the prizes for selling the most candy, but that's because I ate them, and then my parents had to buy them. So that's like just like the beginning of like where my addictions, started with like food, and then, I was obsessive and compulsive with like various toys, like Beanie Babies and Pokemon cards, and it was really for no reason, but other than I got like a high every time I got the next one.
Wow.
Yeah.
So it's interesting with prevention, we talk about things called risk and protective factors, right?
Yeah.
So if we talk about protective factors with Ariele, like what kind of comes to mind as far as prevention goes for us?
I mean, the main one that stands out to me is supportive parents and having a good relationship with your parents, and that is a protective factor.
Yeah.
But just because it's a protective factor doesn't mean that it's going to work for everyone, too. And it just, there are also risk factors on the other end.
Yeah.
So you can have both protective and risk factors.
Right.
Definitely. I think in the way you said you felt inside, that would highlight risk, right?
Yeah.
Right.
So she said she felt angry and frustrated, not okay inside. So that highlights like risk factors. That's so, and just like Emily said, like protective factors, like maybe you come from a neighborhood where drugs aren't readily available, or you have two loving parents and a supportive family, and all those would be protective factors, which would essentially protect you from addiction, or and the risks raises your risk, right? Just what they say. So despite that, again, there's no guarantees.
Exactly.
Right?
Yeah.
Like we probably know people with parents that maybe were both addicted, and their child, the person that was brought up with them never touched a drug in their life.
Right.
They saw it and said, I'll never do that. And then, the latter is true as well.
Right.
So tell me a little bit about some of the feelings you had inside. You talked about the Beanie Baby story, and I've heard this before, but I think our viewers would appreciate it because it seems like an innocent childhood thing.
Right.
So yeah.
Do you mind if I just say like what we were talking on before is that I think that there is no like golden rule or like I don't think it's all one shape or form for what addiction looks like in a child. I think that it's a case by case scenario, and that behaviors can come out. There can be so many different circumstances and, early warning signs and stuff like that.
Absolutely.
So sorry. And to answer your question, I just felt like I wanted to
No,
add that.
absolutely.
And to answer your question, when I was younger, my parents used to pick me up from school, and they'd say, you can either have a Beanie Baby or a chocolate bar, and then you can have ice cream later. So I would get the Beanie Baby and the chocolate bar, and then I always manipulated my way in to get ice cream later. So it's very innocent. It doesn't seem like a big deal, but, like nothing was ever enough for me. Like I always had to have something else as well.
Yeah, it's really interesting. And tell me what growing up, like what neighborhood did you grow up in? What area, schools you went to?
So I grew up in the Fay Estates in Lynn, which is a really nice neighborhood in Lynn. I lived on like a dead end, so I played with all the little kids. I had like, I was very immersed with other people as well, and we had, a really good time hanging out with the neighborhood kids. Meanwhile, I went to private school. I went to, it's now called Epstein Hillel Academy, but it was Cohen Hillel Academy at the time. And, my childhood was really good.
Yeah. And so some of the feelings with like, the collecting things, and what was that like?
So like I would get stuff and I would be like get a high and a rush, and like I'd feel really excited, and then I was like bored of it within a few days, and I needed another thing. It was like that with clothes too. Like I always wanted like more like just for no reason. I just didn't know why either. Like I just wanted more things to kind of, I guess, fill the now that I've worked on myself, I know looking back that it was to fill a void.
Right, right. And did your parents notice anything early on, or do you think it was just, kind of normal?
I think they thought I was just kind of like a brat, or had like had like only child syndrome, so they didn't really. And also, addiction doesn't run in our family.
Right.
Like there's been no other. It was a different time a long time ago, so my grandparents could have been like low key alcoholics. I'm not really sure. It's like kind of a gray area, but they never hit like a rock bottom. It was never like my type of addiction. So I don't think they really like understood what to look for, because they just they weren't around it. They had no idea what it looked like.
Right. Yeah. And I've actually met Ariele's parents several times, and they're very, and so is Emily, right?
Yeah.
Very loving.
Very loving, very involved. Yeah.
Definitely, definitely.
Very involved.
Very involved. There's some inside jokes about that, but we'll leave that for another show when we get your mom on here next time. Cool. So now, can you tell me a little bit about like the first time you experimented with drugs or alcohol?
So I'd say like the first time, honestly, like everything's a blur from like high school and then into my early 20s. It's really hard for me to remember like exact details, but I remember the feelings, which I think is really huge. So the first time was probably about 12 or 13. I want to say maybe end of 8th grade, beginning of freshman year is when I first tried alcohol and smoking weed, and I loved it. I loved the way it made me feel, because I was a very insecure young lady. I had a really hard time connecting with people and fitting in, and when I was able to put a substance in my body, I felt like I could finally connect with people on the level I'd always been searching for.
Wow. Yeah, and I think we've discussed, like, that happens a lot with people. They, have trouble connecting with other people. And, like, I've even heard talks where they say, like, the opposite of addiction is connection.
It is, yeah.
Right?
I truly believe that.
Yeah. So when we use drugs and alcohol, people feel connected, right? Which is kind of sad that we feel like we need to put that in between, that sort of curtain down in order to feel connected to other people.
Right.
Yeah.
Absolutely.
Yeah. So what were some of the first things that you tried?
So the first things I tried, and like throughout high school, is really only alcohol and weed. But like once I started smoking weed, I had to smoke it every day.
Yeah.
Like blunt after blunt. Like it was out of control,
Yeah. And do you feel like a lot of people say you can't get addicted to marijuana. Do you feel like that's true, or do you feel like you were addicted to marijuana?
So I don't think you can necessarily get physically addicted to that. I mean, that's just my opinion. But I definitely think I was psychologically addicted to it. Like that was like, I didn't look forward to anything anymore. Like the other behaviors like Beanie Babies definitely did not matter anymore. Like I found a new solution to fix how I had, and it was a solution at the time, to fix how I'd felt inside. So I definitely like needed it almost every single day.
Right. And did it affect your schoolwork, behaviors, anything like that?
Yeah, absolutely. So I was normally like an A/B student. I had like some minor learning disabilities. I have trouble processing things verbally, but I was I normally was like an A student, did really well. And then once I started drinking or smoking weed, I stopped caring about really anything else. Yeah. So my mom always makes fun of me because my senior year I got an F, but then the teacher wrote pleasure to have in class, which is really interesting, kind of funny. But yeah, so things like that. Just my like famous line was like, I don't care, I don't care, I don't care.
Yeah, yeah. And that's interesting because obviously you had a likable personality then, as you do now. Aside from acting up and getting an F in class, right? Right. Yeah. So people do recognize that usually. If anybody could have shifted, so we know we're going in kind of a downward direction at this point, high school, smoking marijuana every day or blunts every day, which, do we want to explain to the audience what blunts are for those who don't know?
The devil's lettuce.
Wow.
Okay.
Do you want to explain exactly what a blunt is?
So a blunt is just, I don't know what the kids do these days, but back in my day, it was just like a blunt paper, I guess, that you get at like 7-Eleven or something, and they always sold it to us even though we were underage, which is really sketchy looking back now.
Yeah.
But it's, you just roll weed into it and you just smoke it. like that. But I think they have all these other weird things going on
different
with it.
ways.
Yeah, dabbing is big right now,
Yeah.
which is just smoking the oils, which is much more potent. It has a lot of, it's much stronger. It's like 80-90% THC.
Yeah.
So that is common today. Yeah.
Definitely, yeah. So there's lots of slang and street names
Yeah.
change. Even the Neurontin that, or the gabapentin that Emily mentioned in the beginning has a street name.
Johnny's.
Johnny's,
Yep.
yeah. So we'll talk a little bit about that later on. So, okay, we're kind of on this spiral of smoking blunts every day. And at this point, looking back, could anything have sort of intervened and shifted, like you talked about, like rerouting the GPS? Do you think anything could have shifted at that point?
Honestly, I'm not really sure about that because, I mean, maybe, I'm not really sure, but I know that, like, my parents tried to help me. They tried to put me in therapy. I just didn't know how to talk. Like, I didn't know how to communicate properly.
Yeah.
And I think that, like, my brain not being fully developed, you know, because as a young kid, your prefrontal cortex isn't fully developed, so your decision-making skills aren't very good. So it's just kind of, I honestly want to say no for me personally. Like, I don't think anything could have helped me. But I did later on find out that a lot of the reason I used is because I was struggling with misdiagnosed bipolar disorder. So that has to do with a lot of the feelings inside and the reasons why I put substances in my body.
Yeah. Yeah, so mental health issues, as we know, can definitely play a big factor.
And they can be a big risk factor, which we were talking about earlier. Yeah.
Absolutely.
We could explain bipolar maybe to the audience a little bit.
Sure. I can do that.
I know
So
you're good with
bipolar. So basically, it's when somebody has. Basically, it's a high and low. So kind of think of it as like a little stream. So when they're really high, they're manic and they have a lot of energy. They're go-getters. They could stay up for days at a time. And then when they go low, they kind of crash, and that's when they enter depression. So on that end, it's depression. So they have all those depressive symptoms where they can't get out of bed. They don't want to do anything. And it just goes back and forth like a little wave, kind of.
So that's actually bipolar 1 disorder. I have bipolar 2 disorder.
Okay.
So bipolar 2 disorder is there's no manic, there's no mania. So you kind of fluctuate between severe, sometimes suicidal depression, moments of feeling normal and somewhat okay, and then you will reach this thing called hypomania, which is definitely not a good feeling like mania can feel to some people who are experiencing it. Hypomania is more like an internal mania, I guess I'd call it. Like you feel severe agitation, anxiety, irritability. It's like you have all this built up energy and aggression within. Yeah. So that's bipolar 2, and that's what I have.
Okay.
Yeah, thanks for explaining that.
Yeah, of course.
A lot of times addiction comes from, maybe is motivated by just self-medicating.
Right.
The kid doesn't feel right about themselves. They use for the first time and then feel that relief from their symptoms.
Yeah.
Right.
Do you think that's what was going on, possibly, or?
I mean, for me personally, absolutely.
Yeah.
But, as I said earlier, I do not think that addiction is black or white. I know that there's many reasons, different reasons why people use and become addicted to substances.
Yeah. So tell me what happened after high school.
So after high school, my parents, gave me another opportunity. Of course, they were always on my side and handing me opportunities. They signed me up for a one-year program to Israel. It was called Young Judea Year Course, and it was kind of like a study abroad program. You did some volunteering and just connected with other Jewish youth throughout the United States. And, right before I was supposed to leave for this program, I got a DUI, and, after I got this DUI, I kind of got like a slap on the wrist. I got a continuation without a finding, and my probation officer let me go on the Israel trip. So during the whole period of time I lost my license, I was in another country. So, yeah, that's pretty much.
Yeah, so there wasn't like that consequence sometimes
Right.
that like kind of cuts us.
Right.
Right.
I never had consequences.
Interesting.
Ever.
Yeah, yeah. So consequences can definitely be a deterrent.
Yeah, and it's actually you can kind of consider it a protective factor because when parents set rules and they give their kids consequences and they follow through, that's actually considered a protective factor.
Yes.
So yeah.
Yep.
Yeah, so that's pretty wild because I think that does tend to, keep fueling addiction when we don't have to kind of deal with what we're facing or
Right.
deal, right? Or somebody
Right.
else, kind of sweeps it under the rug for
Right.
us or whatever. Yeah, and that's, I think, a typical parent's response or a family's
Right.
response. They want to protect us.
Right.
Right?
Right.
Absolutely. So we only have a few
Yeah.
minutes left.
Yeah, so this is actually just part 1 of our interview with Ariele.
Yeah.
So she's going to be back in 2 weeks.
Yep.
And she's going to talk about the rest of her journey. So you'll hear more about her time in Israel and just her future after that. And then we're going to focus a lot on her recovery next episode as well. So we're looking forward to seeing you there, and we're looking forward to talking to Ariele more.
Yeah, looking
Absolutely.
forward to it.
Yeah,
Yeah,
thank you
some
for coming.
insight on addiction.
Yeah,
Yep.
Cool.
yeah. So this has been.